So let's take a closer look at the anatomical landmarks of a baby. Now, a baby is normally categorized as any child that's under 1 year of age. But there's some important things to think about when we're talking about babies. And this is a nice, healthy baby. You can tell because her lips are nice and pink, her mucous membrane is nice and pink, her nail beds are nice and pink, she's moving around, she doesn't seem to be in distress whatsoever. A baby who might be in distress, especially respiratory-wise, would maybe have some circummoral cyanosis, blue around the lips and around the mucous membrane. Her nail beds might also be blue. Don't confuse that with a cold hand of a baby because that can turn blue as well pretty easily. But I really want to pay special attention to the anatomical landmarks that are going to be really important to identify when we're actually treating a baby with CPR or with chest compressions for a choking baby unconscious. So let's take a little closer look at some of those important landmarks that we talk about. As we open up the onesie, we can see the mid-nipple line. It's important for us to note that we need to put our two thumbs on the center of the chest, right on the sternum, just barely below that mid-nipple line. That's when we're going to do that 1/3 of the depth of the full chest for our compressions at a rate of 100 to 120 times per minute. You can also see now that I have that open, this brachial artery location is right here, right between the bicep and the tricep against that little humerus bone. Because they really don't have much of a neck to find a carotid artery, so we have to actually use the brachial artery for that location. Another thing to keep in mind is they've got such a big head compared to the rest of their body that it tends to put their chin down on their chest. So we're going to want to just get something a little bit underneath their shoulder blades as a nice shortcut that's still firm and won't let them sink into the mattress when we're doing compressions, but that helps to hold their head in that sniffing position. We're also going to take note that this baby's airway is literally only the size, approximately, of their little pinky. That's a pretty small airway. And so as opposed to a child and an adult where we do a head tilt chin lift to open the airway, a strong head tilt chin lift or a chin to the chest sometimes is enough to actually occlude the airway and make it difficult for a baby to breathe. So that's why we put them into a slightly sniffing position, not a full head tilt chin lift. Now you can see too that the size of their fist is pretty small. That's approximately the size of their heart. And it's located right under the sternum in the center of their chest. These are all important anatomical landmarks as we move into the actual training segments of how to give effective CPR and chest compressions for the unconscious choking patient.